a derangement, so you give them some particular exercise that's not particularly challenging. It's designed to maybe reduce the theoretical derangement, and they come back and they're much, much worse. You think that's strange because their reaction is out of all proportion to the stimulus. And I found that really often is an indicator that you've got some referral of symptoms from the spine going on.
Okay.
So I suspect in this fellow's case that might be a factor.
Mm-hmm. Yeah. But in any case, you have little to go by in that worst section. Not a lot can cause it immediately.
No, and the worst part is there's nothing you can do to before and after.
Yeah. So when we're faced with that type of situation, sometimes we feel like our hands are tied a bit. Well, I don't know how to assess this and how to really get any kind of meaningful data. What does a good clinician do?
Well, there's always things that you can do. You've got a number of options. Historically, I was taught this by Robin, with headache patients. If a headache patient came in, I'm here because I've got a headache, because of headache is my main complaint. And he would ask them a few questions. He'd say, do you have a headache now? They say, no, I don't have it at the moment. It's typical. You always present and it's not there. And so he would say, okay, then you come back in when you've got it. Just phone up. You don't need an appointment. Just phone up and say, I'm coming in. Mm-hmm. I've got the headache. We need to see you when you've got it. That's one approach.
Mm-hmm.
But the other way is you can take things from the history and you can use those as a means to determine a course of action. A person might say, well, the typical plantar fasciitis would say, I'm worse first thing in the morning. So you're looking at, can we change that? Not make it better, but change it. Because if we make it worse, that's just as useful.
Mm-hmm.
So the key thing that I have found, I would say the most helpful thing I found in my whole career was realizing that I'm not there to get the person better, which may sound strange, may sound almost heretical, but I realized that eventually that the secret to Robin's success was he was there to assess.
Month after month, new guest experts like Colin Davies presenting actual patient cases like this one and access to all the past. Check out case conversations at mechanicalcareforum.com.